opportunity from Aspen Security Forum, but also an MBC. So I will go straight to my statement, and then we will also receive questions with Mike Rand, my general, and also Maria Bankerkov. By the way, to just correct, Maria Bankerkov is our senior lead on COVID, and she's from the US. Just wanted to correct that. And I want to extend my sincerest thanks to Aspen again and Embassy for inviting Dr. Mike Ryan, Dr. Maria Bankerkov, and I to speak with you today. The events of the last 7 months are a tragic reminder of the insecurity and instability that disease can cause. The COVID-19 pandemic has changed our world. It has stress-tested our political, economic, cultural, and social infrastructure and found us wanting. It has pushed the limits of health systems, both weak and strong, leaving no country untouched. It has humbled us all. The world spends billions every year preparing for potential terrorist attacks, but we have learned lessons the hard way that unless we invest in pandemic preparedness and the climate crisis, we leave ourselves open to enormous harm. Since WHO was created over 7 decades ago, we have worked to galvanize collective international public health action to build a healthier and safer future for humanity, from ending smallpox to bringing polio to the brink of eradication, from rolling out treatment for HIV, TB, and malaria to millions of people across the world, to responding to hundreds of emergencies. Building up all health systems and ensuring health for all is our best shot at delivering on the goal of the global health security. 15 years ago, the global community came together and adopted the international health regulations in 2005. Its implementation by 196 state parties was a major step in the coordination of international action to enhance global health security. Following WHO being notified of an atypical strain of pneumonia circulating in Wuhan province, China, the IHR, the International Health Regulation, was triggered, and the world was subsequently informed of the outbreak in early January. The genome was mapped within the first week of January, and in the second week of January, it was publicly shared, and WHO published how to build a PCR test for COVID-19 from our partner lab in Germany. In the third week, WHO identified and began contracting for validated production of quality PCR tests. And by the first week of February, WHO began shipping tests to over 150 labs around the world, which enabled the world to track and trace the virus around the world quickly. And it was under the IHR, the International Health Regulation, that WHO declared a public health emergency of international concern on 30th January, WHO's highest health security alert under international law. At that time, there were fewer than 100 cases and no deaths outside of China. Today, more than 18.5 million cases of COVID-19 have been reported to WHO, and 700,000 lives have been lost. No country has been spared. Low, middle, and high-income countries have all been hit hard. The Americas remain the current epicenter of the virus and have been particularly hit hard. Just 3 countries have reported over half of all cases. No single country can fight this virus alone. Its existence anywhere puts lives and livelihoods at risk everywhere. It's never too late to turn outbreaks around, and many countries have done just that. So it's never too late to turn the situation around. Our best way forward is to stick with science, solutions, and solidarity, and together we can overcome this pandemic. COVID-19 has also exposed how misinformation poses one of the greatest security threats of our time. Misinformation can spread faster than the virus itself. Since the beginning of this pandemic, WHO has been working to address misinformation. We have worked with all major tech companies to counter myths and rumors with reliable evidence-based advice. Last month, WHO brought experts together from across the world to hold the first conference on how best to tackle the COVID-19 epidemic. Through our daily situation reports and regular media engagements, WHO officers have kept the world informed. Myself, Maria, and Mike have ourselves done more than 90 press briefings. We have, on a weekly basis, briefed our member states to present the latest scientific knowledge, answer their questions, and to share and learn from their experiences with COVID-19. WHO will continue to support everyone, everywhere, and work with leaders, communities, and individuals to foster global solidarity, suppress the virus, and save lives and livelihoods. Even as we fight this pandemic, we just ended the second largest and probably the most difficult and complicated Ebola outbreak in history in the Democratic Republic of the Congo. We have applied lessons from previous outbreaks and innovations developed and researched ethically in conflict situations to bring the deadly disease under control. And just this week, our team in Lebanon is responding to the large explosion that has killed more than 130 people and injured at least 5,000. Whether it's COVID-19, disease outbreaks, or responding to humanitarian and natural diseases, all are intrinsically linked to global health security. While health has often been viewed as a cost, the first coronavirus pandemic in history has shown how critical health investment is to national security. And universal health coverage is essential to our collective global health security. Building back stronger health systems will require political will, resources, and technical expertise in high and low-income countries alike. That's why WHO's highest priority is to support all countries to strengthen their health systems so that everyone, everywhere, can access quality health services when they need them. COVID-19 has already taken away so much. We must seize this moment to come together in national unity and global solidarity to control COVID-19, address antimicrobial resistance, and the climate crisis. For all our differences, we're one human race, sharing the same planet, and our security is interdependent. No country will be safe until we are all safe. I urge all leaders to choose the path of cooperation and act now to end this pandemic. It's not just the smart choice, it's the right choice, and it's the only choice we have. I thank you. Thank you so much again.
विन सिटी का अज़्म हर एक को साहिब जायदाद बनाना। इसी इरादे से विन सिटी डेवलपर्स बार बार लगातार और हर बार बेहतरीन और कामयाब वेंचर्स पेश करते आ रहे हैं। जहांगीर पीरा के बिल्कुल दामन में विन सिटी का एक नया वेंचर शुरू हो चुका है। 100 गज का प्लॉट 4 लाख रुपए में नकदी आसान नक्शा पर प्लॉट्स खरीदिए। तमाम बड़ी बड़ी कंपनियों से घिरा हुआ वेंचर जो आबादी के बीचों बीच है, गेटेड कम्युनिटी में है, क्लियर टाइटल, स्पॉट रजिस्ट्रेशन, ग्राम पंचायत अप्रूव, वाटर, इलेक्ट्रिसिटी और ट्रांसपोर्ट की सहूलत, बेंगलुरु हाईवे से बिल्कुल करीब। विन सिटी डेवलपर्स अनगिनत कामयाब वेंचर्स का रिकॉर्ड रखने वाले। बुकिंग का आगाज हो चुका है, मुलाकात करें। विन सिटी डेवलपर्स, चॉइस फंक्शन हॉल के बाजू, चंद्रा इन गुट्टा, हैदराबाद।